Hey y'all, good day. I'm Dr. Ruth Roberts, the creator of the original Crockpet Diet. And I've got a bunch of questions you guys sent in, which is fantastic. So I'm happy to get those answered for you. And I wanted to give you a little bit of an update. I went, as I mentioned last week, I went to the Ammon Clinic to get a scan done of my brain to see if I can get some help in getting some improvement in how my brain's functioning. And it was a very interesting experience. The images that they're able to produce look specifically at the shape of the brain, so you can get an idea as to whether there's been, trauma damage. So, we all do stupid stuff when we're younger that thankfully doesn't often kill us, but it does have consequences later in life. And so they were able to see some very mild changes there, and then the more issues that I'm having is the other way they were able to image the brain is to look at blood flow to specific areas of the brain. And so what they were able to tell me is that there's something, and whether it was the mold exposure that I experienced a couple of years ago, or possibly Lyme disease or heavy metal toxicosis, that's preventing adequate blood flow to the cerebellum from happening. And so if you can't get that stuff processing in the back of your brain, it's difficult then for ideas or things that you need to act on to go to the prefrontal cortex, which is where you're able to say, okay, I need to do this now. So the upside is that they were able to offer several options, and one is certainly diet. I've been eating paleo, which is what the Crockpet Diet is a version of, for over a decade now. And so they recommended that I go back to ketosis diet, which, if you are not familiar with that, is an extremely high fat, very low carbohydrate, and then moderate amounts of protein. And indeed, in 2013, I was able to use this approach to life, to eating and things of that nature, to help drop a terrific amount of weight. So back on that. And then the other thing they recommended doing was intermittent fasting, which sounds really daunting to most of us because we're accustomed to eating 3 meals a day plus a snack. And essentially what happens with intermittent fasting is that you fast for 16 hours out of the day, most of which is when you're sleeping, and then you have a period of about 8 hours where you actually eat. And so that's where I'm heading. I've been able to start that today, once I was sure that some of the medicines I've been taking were not going to upset my stomach, and also the supplements. And they also had a very detailed supplement plan to help improve blood flow to the brain and improve function there. So I'll get you guys updates on that and let you know how that works out. But one of the supplements that I've already suggested for dogs that have dementia-like symptoms or sundowner syndrome is alpha-lipoic acid, and they recommended a much higher dose than I'd recommended before. So I'm trying it at a much higher dose, and Esau is too. He started to get a little bit of paciness at night, and just sort of like a sundowner syndrome behavior. And so far, I think it's beginning to help. So we're using a couple of supplements for him to help with that, and that's been much better for him. He's much more relaxed and comfortable. So that's what I know good on that front. It's always great to have the opportunity to take another approach and then combine that with a more conventional approach. So one of the other things they saw was an ADD type pattern in the brain, and that's not shocking. I was diagnosed with dyslexia at I think 8 or 9 years of age, and took Ritalin as a child. So one of the other things they suggested was using one of those type of medications to help improve focus and that sort of stuff. So it's awesome, and that's part of why I sought out some help from the folks at the Ammon Clinic, because they're able to do an integrative approach, incorporating both behavior, so meditation is another thing they recommend, so lifestyle modifications, diet, supplements, medications as appropriate. So that's what I do for a living, so I'm walking the talk. So see, Susan Riley jumped in with us. Good to see you, Susan. Hope everybody's having a great day today. I've got several questions here. The first one's from Patsy, And she's asking how much vitamin C she should give a 60-pound dog who gets crystals in his urine, and also should I give him cranberry supplement. So the concern is that the more vegetables you eat, the more alkalinizing the diet tends to be. And indeed, when many of my patients started on the Crockpet diet, started eating a lot more vegetables, we'd see their urine pH go up, and become more alkaline. And so normal urine pH is 7 to 7.5. And there's a couple of ways, if the urine pH is up at 8, that we can help drop that urine pH down. Methionine is the one that most veterinarians are familiar with, and that's fine. Ascorbic acid or vitamin C is another one. And the interesting thing about that is that if you look at the literature, it says that vitamin C actually doesn't do much for acidifying urine. In practice, I can tell you that it does. It may take a couple of weeks, but any of those types of changes, you don't really want to recheck until like 3 weeks later until things have kind of smoothed out. So the dose I typically recommend is something like 250 milligrams for a 25-pound dog, and then 500 milligrams a day for a 50-pound and up dog. And then that's sort of the starting place. And that's where, in 2 or 3 weeks, I would get some pH strips or pH paper and check your dog's urine pH. Pick one time during the day when you're going to check it consistently, because it is going to vary through the day. And so, again, target range is 7 to 7.5. If it's high, meaning greater than 7.5, then that's when we'd want to use a little bit of vitamin C. If in 3 weeks you find that it's better, but it's still not quite there, then try twice-a-day dosing. And again, because vitamin C is a food, essentially we're adding this to the food, which helps to get it down. And that's usually fairly simple to accomplish. If you find after another 4, 5, 6 weeks that the urine pH is still not dropping, that's when I would generally use methioform, which is an amino acid. And the trade name product came off the veterinary market, and so we found out that you can buy it as a human supplement and then use it from there. That's really when you need to talk with your veterinarian about the dose that's appropriate for your dog. If the pH is low, hey Sally, good to see you, and good to see Letitia as well. If your pet's urine pH is low, meaning 6.5, 6, that kind of stuff, generally most of the commercial pet foods have been engineered to drop the urine pH that low. And the issue is that instead of having just struvite crystals, which form in an alkaline pH, we now have pets that are getting calcium oxalate crystals that form in an acidic environment. And so that's when we need to bump the urine pH up a little bit. We need to alkalinize it slightly. And so the simplest way I've found to do that is to use baking soda, which is an alkalinizing agent. And literally for smaller pets, I'd start with literally a pinch. Larger pets, maybe a quarter teaspoon. And again, use the pH papers to test, starting in a couple of weeks, to see where you are and what you need to adjust for your pet. Now, do you need to use that long term? Probably you may have to. But again, what you need to continue to do is to test. So once things have stabilized, then say every 2 or 3 months, just randomly check the urine pH. And I mentioned last week the easiest way to do that for boy dogs is a soup ladle. For female dogs, just take a cookie sheet or something and slide it under her bottom as she's urinating, which she may take offense at originally, but if you do it gently and try not to touch her, it's usually not so awful for them. The other question that Patsy asked is about cranberry supplement. And where cranberry supplements are useful is in chronic bladder disease. And so that's where there's been chronic bacterial infections. The way cranberry supplements work is that they prevent these little feet from 2 species of bacteria, E. coli and Pasteurella multocida, from attaching to the bladder wall. And that's where using cranberry really is helpful. So if your dog's had chronic bladder disease, chronic bladder infections, there's a supplement on my website called Bladder Support, and it really has worked very well as far as decreasing inflammation in the bladder. Another thing that can be really helpful too is D-mannose. So those are all options. There's some info on the website. Certainly I'd love for you to buy the supplements there, but really that's a starting point for you to figure out what's going to be helpful for your pet. So that's what I know about crystal urea, or at least part of it anyway. And Letitia Ray and some other folks are sharing this video, and guys, I really appreciate that. The more we can get the word out, the more pets we can help. And hey, Kathy, good to see you too. Another question, actually two questions in the same sort of frame. One question from Ann Noel, who's a very lovely woman, and I had the opportunity to work with her older dog that had cancer, and we were able to help improve her quality of life for months and months, which is fantastic. But she's got a new dog, and she's feeding the Crockpet Diet and using supplements. She's also using some Stella and Chewy's raw-coated kibble along with the Crockpet recipe, and because she was going to board her pup and just wanted to make it easier to do it. And so she wants to know if she's harming her dogs in any way or unbalancing their symptoms. And so she's concerned about that. And Patty wrote in and said that she's been feeding her pups the Crockpet Diet and they're doing great, which is fantastic to hear. She's also been using Dynavite mix when she feeds them. And should I also consider adding a multivitamin or use a multivitamin instead of the Dynavite? And one of her dogs has severe seasonal allergies that's almost completely cleared up with this regimen, and that is fantastic too. So to both of your questions, when you feed conventional food, here's the thing you want to make sure of. Stella and Chewy's does quite a bit better job of processing the food, so it doesn't take out so much of the vitamins. But the nutritional content of food is determined, that's stated on the bag, is determined prior to processing. And so most dog food is produced by extruding it through this thing to produce the kibble, and then that creates a lot of heat in the food, which destroys vitamins. And then even if kibble is baked, it's also destroying vitamins as well. So for that reason, and then the other issue is that many brands of food, the bags are stored for 6 months often before they get that out to you, or you buy it from the store. And so that's another period of time where vitamin degradation can happen. And so for that reason, I do strongly recommend that any animal that's, regardless of what they're eating, whether they're eating the Crockpet Diet or whether they're eating commercial food, that they have some sort of a multivitamin on board. I'd love to tell you it's Holistic Body Support, which I had produced, and I think it's a great option, but there are many of them out there that are complete and balanced. And Dynavite, I think, is more targeted to the skin. If your dogs are tolerating it well, that's fantastic. What I would do is compare the ingredients and the nutritional profile to what's in Holistic Total Body Support, and use that to make a determination. It's my recollection that Dynavite has some brewer's yeast and a few other things that may potentially be allergenic, and so that's an issue. Now, the flip side is that Holistic Total Body Support does contain some protein-based beef and pork protein-based items, and so that can create some issue allergy-wise for dogs. So at any rate, where I was trying to go is, again, with Patty's question, Dynavite's working well for her pups, and so she doesn't want to break what's working. And so Dynavite, as I said, I think has brewer's yeast in it, although they may have changed their formula. So that can have some potential effects on allergies. And again, Holistic Total Body Support, there are glandular materials that contain beef and pork, most of which will not create any issues, even for animals that have beef allergies or pork allergies. And so that's generally a safe bet. The other thing is the filler in holistic total body support is alfalfa, and so you're not going to have, chicken, which is a very common allergen in there. So hope that helps you, Patty. And then, Ann Noel, back to your question. Yes, I would continue to use holistic total body support, and no, it should not unbalance everything. So I think you should be in good shape there. So that's what I know about the vitamin supplementation, but that's why I so strongly encourage using a multivitamin regardless of what your pet's eating, because the quality of the vitamins deteriorate both during the processing of the food and during storage as well, so not so great. And the other issue is that the soil quality is so much less than it used to be years ago. So that's one of those other reasons. Jennifer wrote in and said that I treated her dog Clementine some time ago for elevated liver enzymes, and what we ended up doing is actually fixing her gut, and then because her GI system, the good bugs, were able to detoxify, the liver enzymes came back down to normal, which is awesome. So it's always interesting how that laces together. And she just had an abdominal ultrasound done to check a splenic nodule, which is still small, which is fantastic. But the report said that her kidneys had a mild loss of corticomedullary distinction. And so if you look at a kidney, it looks kidney bean shaped, right? So the cortex is this thick layer on top, and then the medulla is where the filtration actually happens, and then under that, the pelvis, where the urine collects to go out into the bladder. So the distinction between the cortex and the medulla, not so good. And what that means is that there's some degradation of function there. So she's 7, and she's a bloodhound, and so the larger the breed, unfortunately, the less time they're with us. So 7 is sort of like 10 to a poodle-sized dog. So she's getting some age there, but her lab values are all normal. So her veterinarian said, okay, go to a low-protein diet. And she's wondering if that's really what she needs to do. And so this is, again, where I would say, no, probably not. You may consider asking your veterinarian about an SDMA test, which will give you some idea about how well the kidneys are still processing the waste products out of there. This is where I keep using Crockpet Diet, which I believe she still is, and add in quercetin, because that's going to really support kidney function. The interesting thing about quercetin is that it's a fantastic antioxidant. We typically think about it in terms of allergies because it does help to reduce circulating levels of histamine so you're not so itchy. And the reason quercetin works so well for kidney disease is that it prevents the deposition of advanced glycosylation end products, which is a mouthful, but the acronym for that is AGE, and that's truly what happens. These are the things that cause aging. So they cause the kidneys to fibrose and destroy function there, and other organs, so the brain, the heart, everywhere. So quercetin's a great supplement to help prevent that from happening. Again, it's available on the website. There's some dosing there so you can get an idea about how to use it. Really no side effects. And I think the reason I started using it is that I ran across some human studies where people that had had organ transplants and have to stay on cyclosporine to prevent organ rejection lifelong, they found that because cyclosporine's target organ for toxicity is the kidney, that using quercetin along with it prevented that organ damage, which was fantastic. And it's played out in practice. We've seen animals' creatinines continue to drop and drop and drop. And you're welcome, Jennifer. I'm glad that's helpful. So Beth is asking about her 26-month-old fearful husky mix, and she has periods when she eats grass like a lawnmower and then throws up baseball-sized balls of grass and then starts right over again. And her veterinarian has said it's probably just anxiety. She's wondering if probiotics and digestive enzymes will help. She's seeing them as an additive and a chewy treat. And then she normally cooks rice to add to the food. But without the rice, then say around 1:30ish, she's barked and she's vomited. And so this happens with various and sundered types of food and dry food. And Beth is an owner of a local pet store here in Charleston, and these guys are great, and they've helped so many people figure out what to do with food for their pets. So I'm going to tell you that really cooked diet is the best way to go in your situation. And I know you guys work long, hard hours. What I've told many clients is to pick high quality dry foods, which you've got available there in your store, and rotate them. So that you're not feeding, pick small bags and feed different proteins each time you run out of the dry food. And then make up the vegetable portion of the Crockpet Diet, or get a bag of Normandy blend vegetables and add that in. Take a half a cup and cook it and add it to each meal. And I think that's been very helpful. You can get some moisture into the belly. A lot of times with dry food, it's hot. You're living here in Charleston where it's hot, and you've got a hot, anxious dog. And so that heat tends to make everything sort of get worse in terms of Chinese medicine. So I would do that. More green vegetables are cooling, so certainly focus on that. And then I would definitely work on the anxiety. I mean, it's really clear in people that the more anxious you are, the more GI issues you have. From nausea, vomiting, inflammatory bowel disease, all of those things, or inflammatory bowel syndrome. So I think you need to work on kind of both aspects. Probiotics will help because, again, we're trying to restore the good guys in the gut so that they are making the right neurotransmitters and making it easier for her to digest the food. Same thing with digestive enzymes. They may be helpful in terms of getting the food down. And then as far as anxiety goes, one of the most effective things I've found is liquid Nutricalm, which is a tryptophan and theanine based product that you can add. Usually we'll use the liquid version, and there is a capsule one as well, but it's salmon flavored, and so it's really easy to get both dogs and cats to eat it to help work on the anxiety. If you've not used them, Adapto collars are awesome. I think there's a pet store version of that as well. That's a pheromone based collar that helps to reduce anxiety. And then, Husky needs a job to do. And if you think about it, they were built to run the Iditarod or run sleds through the Arctic. And so when they don't have a lot to do, that can enhance their anxiety. So if they don't have a job. So I'd work with training, work with one of the local trainers to, do basic obedience stuff certainly, but, there are folks that do tricks classes and, real life meet and greets with other dogs so that they get used to different social settings, things of that nature. So those are all things I would work on as well. So you've got kind of a multifactorial thing going on there. So Beth, I hope that helps you. And that's really pretty much what I've got for you guys to get today. And do you have any other questions? I thought I saw a question about rawhide chews earlier in the first part of this. And again, sorry for the interruption, but yeah, it was an ugly thing. But, chews are another great way, things for them to chew on, or puzzles to solve, things of that nature. Those are great for keeping dogs like that are like these Huskies that are very anxious busy, because it gives them a problem to solve and that sort of thing. So if you guys have questions, let me know. Thanks for sending in all these questions. That's great. I'm so happy to have so many things I can help you all with. The other one thing I did want to let you guys know too is that we introduced different kind of pricing structure for the holistic total body support. So the more you buy, the more you save. And so that's available on the website now, and I think it's set up as if you buy 3, basically you pay for 2, so you get 1 free. And then if you buy 12 bottles of something, which for people that have a multi-pet household, this is where it makes sense, you're going to pay for essentially 7 bottles and get 5 free. So hopefully that helps you guys out soon too. So keep the questions coming. Always enjoy answering them. You guys have a great rest of your day. And until next week, remember, your pet's best health starts in the bowl. Thanks much.